Welcome to RadicalWellnessTV.com. This is Laura Lee, and I'm here to show you some ideas and tips on how to take care of yourself naturally, proactively for yourself. I'm talking about mental wellness, so we need to know what mental illness is. So what this is about OCD, which is Obsessive Compulsive Disorder, and this is a brochure from NAMI. Anyway, the treatment of OCD is what I'm on, is continued from part 1. Pharmacotherapy Clinical trials in recent years have shown that drugs that affect the neurotransmitter serotonin can significantly decrease the symptoms of OCD. Medications are of great help in controlling the symptoms of OCD, but often if the medication is discontinued, relapse will follow. Most patients can benefit from a combination of medications and behavioral therapy. Now, natural healers would be the last thing that we would do as medications. The first thing that we would do is cleanse and nourish and get some good happy thoughts going and some feeling good style choices. But that's a side point. Anyway, behavioral therapy, traditional psychotherapy aimed at helping the patient develop insight into his or her problem is generally not helpful with OCD. However, a specific behavior therapy approach called exposure and response prevention is effective for many people with OCD. In this approach, the patient is deliberately and voluntarily exposed to the feared idea or object either directly or by imagination, and then is discouraged or prevented from carrying out the usual compulsive response. Excuse me. For example, compulsive hand washer may be urged to touch an object believed to be contaminated, and then may be denied the opportunity to wash for several hours. When treatment works well, the patient gradually experiences less anxiety from the obsessive thoughts and becomes able to do without the compulsive actions for extended periods of time. Studies of behavioral therapy for OCD have found it to produce long-lasting effects. To achieve the best results, a combination of factors is necessary. The therapist should be well trained in the specific method developed, the patient must be highly motivated, and the patient's family must be cooperative. In addition, in visits to the therapist, the patient must be faithful in fulfilling homework assignments. For those patients who complete the course of treatment, the improvements can be significant. With a combination of behavior therapy and other things, the majority of OCD patients will be able to function well in both their work and social environments. Families of people with mental illness face many stresses, financial burdens, emotional upheaval, and practical problems of living with someone who is seriously ill. Nearly 40% of persons with schizophrenia live with their family. Families are not the cause of serious mental illness. Most can benefit from support of other family members through self-help groups such as NAMI, National Alliance for the Mentally Ill. Violence among people with mental illness is not common. They are more frequently the victims of crime than the perpetrators. Horror movies featuring stereotypical psychotic killers are not realistic depictions of persons suffering from the mental illness. So remember that. Education programs, family to family for relatives of mentally ill, provider courses for clinicians, support groups for family and friends of the mentally ill, guest speakers, information available resources, legislative updates on mental health, and newsletter. That's what NAMI offers. NAMI Slow is what we work with because we like to love life and life will love us back. So let's just be aware that the mental illness is probably up on the uprise. So when you bump into somebody or somebody in your circle becomes a little not right for serious, you might want to know what's in front of you. So anyway, love life and life will love you back. Please like and share and comment. Bye-bye.